My name is Musa Ahmad Salicham, Financial Assistant of Nesthet Clinical Services. Nesthet Digital Health is a partnership between 5 companies to provide essential healthcare services to the inhabitants of KMC during the COVID-19 pandemic. Neglect of non-COVID-19 diseases such as hypertension and diabetes. Reduction in income generation capacity of inhabitants of KMC due to the national lockdown. Fear of visiting the healthcare facilities due to COVID-19. Cut down on non-emergency services in most of the hospitals such as outpatient departments and general clinics. Our solution is a digital healthcare platform that will work by the use of telephone, internet, courier and mobile money to deliver home healthcare services. 50% discount on all service fees for the period of 100 days and the creation of revolving fund to pre-finance the healthcare bills of clients. According to Data Breach Market Research, the home healthcare service market will be worth $613 billion by 2027, growing at a compound annual growth rate of 8%. Asia Pacific is expected to have the highest growth rate in the forecast period of 2020 to 2027. According to WHO, in 2016, the prevalent rate of diabetes ranges from 5 to 6.5% in the Gambia. Bicham and colleagues in 2018 revealed that 70 to 80% of the Gambian population with hypertension are undiagnosed. Nesthet is currently embarking on a COVID-19 home screening and sensitization campaign, which is expected to reach 60,000 individuals in 3 months within the Banjul and KMC. 10 to 20% of which is expected to fall within our target population. Despite having strong competitors, we are expected to get 50 to 60 market share in the Gambia in the next 10 years due to our proven business model, dedicated team and available technology. From January 2020, Nesthet Home Healthcare have registered 65 clients and we have already reached our 6,000 individuals through our COVID-19 house-to-house sensitization campaign. Direct beneficiaries, inhabitants of KMC with chronic diseases, elderly and the working class within the ages of 18 to 60 years. Indirect beneficiaries, partners and policymakers in health. The target population group will have access to quality healthcare service at home without paying a penny on the spot. Have access to flexible healthcare bill payment plan for up to 30 days. Have access to their electronic health records anytime after the COVID-19 lockdown period. The partners will have access to more clients, more revenue and more visibility during the COVID-19 lockdown period. The policymakers will have better health outcomes during the pandemic and access to accurate data on the prevalence of chronic diseases in the Gambia. Those user groups, WhatsApp, emails and healthcare management system software. Reduce the negative health impact of the COVID-19 lockdown. Increase access to quality healthcare services at home during the pandemic. Reduce contact between sick patients. Eliminate paper-based healthcare record system. Increase revenue visibility for 5 companies during the lockdown period. Measures of impact. Number of beneficiaries of the project. Revenue generated through the previous year. We have a core team of 3 full-time staff, 2 part-time, implementation team of 13 and advisory team of 10. Dex delivery services, TIC Diagnostic Laboratory, Office Park Media, T-Care Gambia, Ministry of Health and Social Welfare and QSA. Total amount required, $1 million, 500,000 equipment and essential supplies, 500,000 revolving funds. Why Nesthet? Nesthet Clinical Services is established with the vision of identifying problems in the healthcare sector and finding innovative and sustainable solutions to the problems. The fact that Nesthet Clinical Services evolved from a small-scale peri-urban drugstore in 2015 to a modern home healthcare service provider in 2020 makes us the best candidate to implement this project. For us to satisfy the healthcare needs of the inhabitants of KMC and move the Gambia towards the next generation of digital health delivery. Thank you for your consideration.